Mr. President, I rise once again today to talk about the urgency of us passing the Comprehensive Addiction and Recovery Act in the House of Representatives. This is legislation that passed the Senate with a 94-1 vote about a month ago. In fact, the senator from Minnesota who just spoke, Senator Klobuchar, is one of the 4 original co-sponsors of this legislation, one of those who feel so passionately about it, along with Senator Whitehouse, Senator Ayotte. But 94 senators, all but one senator in this chamber, when this vote came up for a vote, said, "This is important, it's urgent, we need to address it." Passing it in the Senate with that kind of a vote meant that the House of Representatives would likely take it up quickly, partly because over the last 3 years we've worked with the House. We didn't just make this bipartisan, we made it nonpartisan. We didn't just make it a Senate project, we made it a House-Senate project. It was bicameral. So we introduced identical legislation here in the Senate as to the legislation in the House. They now have, I think, 119 co-sponsors of that bill in the House. It's been subject to a lot of hearings over here. It's been subject to 5 different summits we had here in Washington, D.C. We brought in experts from all over the country to tell us what to do. We don't have all the best ideas here in Washington, so we got the ideas from around the country. And one reason the legislation got this strong vote of 94-1 here in the Senate is because, indeed, it does address the problems people see in their communities. I want the House to act on this because it's so urgent. This legislation will help right away in terms of helping to prevent drug abuse, help the young people to make the right decisions, helping to get people into treatment and into recovery that's evidence-based, that works, rather than people overdosing and dying from this heroin and prescription drug epidemic. Mr. President, it's been more than a month. Every day it's estimated 120 Americans died from drug overdoses. That means we have now lost more than 3,800, that's 3,800 Americans to drug overdoses since the legislation passed the Senate. We can't wait. We have to move, and we have to move quickly on this because it is an epidemic. The experts say that from 2000 to 2014, the rate of overdose deaths doubled, leaving nearly 500,000 Americans dead from drug overdoses. That's why we call it an epidemic. In Ohio alone, we've lost 160 Ohioans since the Senate passed CARA. In 2007, drug overdoses have killed more Ohioans. Since 2007, drug overdoses have killed more Ohioans than car accidents. So car accidents used to be the #1 cause of accidental death in Ohio. Now it's drug overdoses. It's probably true in your state, too. According to the CDC, Center for Disease Control, Ohio now has the 5th highest overdose death rate in the country. Top 5, not something to be proud of. Statewide, overdose deaths have more than tripled from 1999 to 2010. We're now told 200,000 Ohioans are addicted to opioids right now. It's not slowing down. Unfortunately, this crisis continues, and therefore our response cannot slow down. In fact, it needs to speed up. Washington's not going to solve this problem. It's going to be solved in our communities. It's going to be solved back home. But we can help. We can be better partners. That's what the Comprehensive Addiction Recovery Act, CARA, does. It makes Washington a better partner to be able to save lives. Last week, I talked about how this is affecting one of our cities in Ohio, Cleveland, Ohio. I'd like to update you and my colleagues in the House on what's happening in Cleveland, Ohio. From March 10th, the day we passed CARA, to March 27th, the latest numbers we have statistics for, 29 people died of overdoses. And that's just in one 17-day period in one city. One long weekend during that period, 8 men and 4 women died of overdoses. One long weekend in one city, 12 Ohioans. That included a 21-year-old. It included a 64-year-old. Some of the victims were white. Some of the victims were African American. Some of the victims were from the suburbs. Some of the victims were from the inner city. This is affecting all ages, all races, all backgrounds, all zip codes. Some of you may have heard the story of Jeremy Wilder because he got some notice. He's from Portsmouth, Ohio. One of our areas that's hardest hit in Ohio, by the way. In Portsmouth, Ohio, we had a town hall meeting 6 years ago where I brought in the drug czar and we brought in law enforcement officials to deal with the prescription drug epidemic that was exploding at that point in Portsmouth, Ohio. As we made more progress on prescription drugs, heroin started to come in, a cheaper alternative, and more people, unfortunately, got into the grip of that heroin addiction. Jeremy Wilder of Portsmouth, Ohio, said he became addicted to heroin and then he sold drugs to pay for his own use. He told National Public Radio this, and I quote, I sold dope to cops. I sold dope to lawyers. I sold dope to doctors. I had a cop that used to drive me to my drug connection. Rich kids. I had 2 friends who were really wealthy, and because of their addiction, their parents have nothing today because their children just drained them. It's on National Public Radio talking about this. There's no demographic, no state, no city, no county that is safe from this epidemic. One of the big issues we have now in Ohio is heroin laced with what's called fentanyl. Fentanyl is an even more powerful drug. In 2013, 5 people in Cleveland died of overdoses of fentanyl, which we're told is up to 100 times more potent than heroin, depending on the fentanyl. In 2014, that number increased by more than 700%. So from 2013 to 2014, a 700% increase to 37 people dying. Last year, by the way, that number more than doubled to 89 people dying of fentanyl overdoses. Over the weekend, 4 weeks after the Senate passed CARA, in the middle of the day, a man overdosed and died at a McDonald's in a suburban community outside Cleveland, in front of a lot of people and a lot of media interest as a result. In Franklin County, annual overdose deaths have nearly quadrupled in the last decade. In Toledo, we lost 214 people to overdoses last year, a 50% increase in just 1 year. 1 year. We think now 10,000 people in the Toledo area are addicted to heroin or opioids. People in Akron have been heartbroken over the story of Andrew Fry. Andrew's mom was a heroin addict. Andrew, his mom, and his grandmother all did heroin. Last week, Andrew's mom found him dead at the age of 16 in a Summit County hotel room. That was just last week, 16 years old. Summit County, by the way, where Akron is located, has seen their overdose death rate double in just 5 years. So I think you get the picture. This is clearly a growing epidemic. It's a problem that must be addressed. As I've said, Mr. President, no zip code, no congressional district is safe from this threat. In Ohio, we understand that. Just in the last few weeks, there have been summits on this issue in Cincinnati, in Middletown, in Centerville, in Cedarville, Ohio. Again, suburban, rural, inner city communities are all affected. On March 23rd, nearly 2 weeks after CARA passed, the Franklin County coroner, Dr. Ahani Ortiz, convened the Franklin County Opiate Crisis Summit. She says she has seen children as young as 14 die of drug overdoses in her community. She has seen toddlers and seniors alike die of overdoses as the coroner in that community. There's a sense of urgency across Ohio about this, a sense that it's gotten out of control. It's in the headlines. People understand it. Washington could use that sense of urgency too. Communities are taking action. Ohio is taking action. Your state is taking action. The United States Senate has taken action by a 94-1 vote. That means it's now time for the House of Representatives to take action. Right now, the House version of CARA has 113 co-sponsors. This bill was written together with us on a bipartisan, bicameral basis to ensure that we could get this legislation through to the President for signature and get it out to our communities to begin helping to avoid not just these overdose deaths, but all the dislocation that's occurring because of this epidemic, all the families that are torn apart, all the communities that are devastated. Prosecutors in Ohio tell me 80% of the crime is related to this opiate addiction issue. I know the House Majority Leader has said he wants the House to take on this drug epidemic and pass legislation sometime this month. I appreciate that. I know he's sincere. I watched the Republican Weekly Address by Congressman Bob Dole of Illinois. He did a very good job. It's clear to me he's passionate about this issue, and I appreciate his advocacy on behalf of those who need our help. But I would say I didn't notice any hearings or markups this week. I would say we've passed this legislation. It's been subject to all kinds of scrutiny and hearings. It passed with a 94-1 vote. Are there other ideas? Of course there are. And that's fine. But we know these ideas work. Better prevention, better education, more people into treatment and recovery that's actually evidence-based that works. Helping the police officers to have the Narcan they need to save lives, this miracle drug that can stop an overdose from turning into a death. Helping to ensure that prescription drugs are taken off the bathroom shelves, that we stop this overprescribing by having a good drug monitoring program, because most people who are hooked on heroin started with prescription drugs. We know these things. This legislation does this. It does provide around $80 million in additional funding going forward. That funding is needed, again, to be a partner with state and local governments and nonprofits, not to take their place. We know this works. Let's get this legislation passed. Let's move this legislation separately. It could be sent to the President's desk next week. We could begin to make progress now. If there are other ideas, that's great. Send them over here. We'll work on them. We'll work on our own ideas. There's always more to do on this issue. Unfortunately, there's always more to do. But we know that the bill we passed here works. We know it's bicameral. We know it has the co-sponsorship in the House to be able to get it done. We hope that the House will simply put CARA on the floor, pass it by a large bipartisan margin, just as the Senate did, and get it to the President to his desk for signature. This is close to being an historic achievement for this Congress and, much more importantly, for the American people. It's really one vote away on the House of Representatives floor. I'll tell you why it's going to pass. It's going to pass because senators from every state in the union representing every single congressional district supported this bill. It has the support, more importantly, from groups all over the country, 130 different organizations, stakeholders, the people who represent those who are in the trenches dealing with treatment, in the trenches dealing with prevention, our law enforcement community, the Fraternal Order of Police, the National Sheriff's Association, they all endorse this legislation. These groups understand what's needed and they want this help now. This is a unique opportunity for us to move forward with something in this political year, in this partisan atmosphere. This is one that should not have any partisanship to it at all. It should just get done. Senator Whitehouse, Sheldon Whitehouse, and I crafted this legislation together, again, working with others in this chamber we talked about earlier. We crafted it with a lot of different stakeholders from around the country, holding 5 forums on various aspects of the debate. These forums were here in Washington, but we brought in the experts from all over the country, knowing that that's where the best ideas were going to be. The best practices from around the country are represented in the legislation. We've done this. We've done the fact-finding. We've consulted with the experts, with the doctors, with law enforcement, with patients in recovery, with drug experts, the drug experts in the Obama administration, including the White House Office of National Drug Control Policy, including the Department of Health and Human Services, the Department of Justice. We brought in people from all over, and they agreed this is where we can make progress and make progress now. That work is important. It should not be ignored. But much more important is the fact that people out there are waiting for us. They're waiting for us to act. Thousands of veterans, pregnant women, first responders are waiting because this legislation affects all of them. Every single one of these groups would benefit from CARA, and they want it now. Think about the peace of mind we could give parents by expanding prevention and educational efforts to prevent prescription of opioid abuse and the use of heroin, so their kids don't make that tragic mistake of experimenting one time, which is sometimes all it takes. CARA would give them some peace of mind. CARA would increase drug disposal sites to keep these medications, these prescription drugs, these pain pills from getting into the wrong hands. We're already told by the Center for Disease Control that the amount of prescription opioids sold in the United States nearly quadrupled since 1999. And yet, there's not been an overall change in the amount of pain that Americans report. So how do you explain this dramatic increase in prescriptions? Some of these drugs are being abused or sold on the street to addicts. A survey in 2013 found that 4.5 million Americans use opioids for non-medical purposes. CARA would help make sure the prescription drugs don't get in the wrong hands and set up the drug monitoring program to better know who is getting these drugs and why and be able to stop the inappropriate use. CARA would create law enforcement task forces to combat heroin and meth and expand the availability of naloxone, this Narcan, to our law enforcement and first responders. They know how important that is. They know if they had more training and more availability, they could save more lives. Again, that's why law enforcement, including the Fraternal Order of Police, supports this legislation. And thank God we have them out there. If you talk to your police officers or you talk to your firefighters, you will find that they are doing this work every single day. They are intervening and saving lives every single day in your community. They know that this addiction epidemic is driving lots of other crime, too. It causes thefts, violence, human trafficking. Last month in Columbus, I met with a group of trafficking victims. These were women. They all told me the same thing, which is their pimps, their traffickers, got them hooked on heroin and then trafficked them. And in each case, they were trafficked on this website, Backpage.com. This drug issue and human trafficking are definitely related. We're told by law enforcement, again, that so much of the crime, the majority of the crime in our state is being driven by this drug addiction. There's so many heartbreaking stories, but there are also stories of hope. I've seen them firsthand. I've met people who have been in recovery, who have made it through to the other side. So part of what this legislation is saying is that this addiction issue is an illness. Addiction is an illness like other illnesses, needs to be treated that way. It's a disease. But also, part of our legislation is saying there is hope. We have seen where treatment and recovery that is evidence-based can work to get people's lives back on track, to bring families back together. I've heard so many stories. I was at a treatment center in Athens, Ohio, a couple weeks ago, meeting with women who are now reunited for their children for the first time in years because they have taken the brave and courageous step to get into treatment. This grip of addiction is very difficult. It's very difficult to escape from, but they have done it. They're now in long-term recovery. They're back at work. They have the dignity and self-respect that comes with taking care of their family and being at work. On March 29th, 19 days after we passed CARA, the President spoke at the National Prescription Drug Abuse and Heroin Summit in Atlanta, Georgia. At that summit, we heard from Crystal Ertley of Shelby, Ohio. She told her story of trying Vicodin because someone offered it to her. She became addicted because she tried it once. But eventually she needed something stronger, and pills weren't always available, and they were more expensive. But heroin was more readily available and cheaper, so she started using heroin. She would drive an hour to Columbus, Ohio, with her 2-year-old daughter every day to get her heroin. Her addiction drove her to theft, but her family supported her and begged her to get help. She is now getting treatment. She's more than 1 year sober. She's part of an outreach program, the Urban Minorities Alcohol and Abuse Outreach Program. She's taking opiate blockers, drugs that actually block the effects of opiates. This is exciting new medication. She's getting counseling. She's part of a support group with other people in treatment. It's working. It's working for her, and it's working for many other Americans. She's dedicating herself to eliminating the stigma around addiction, to get more people to step forward and to get into treatment, because she knows that if you treat addiction like other diseases, it will have an impact on that stigma. More people will come forward. More people will be able to get their lives back on track. So there is hope. Addiction is treatable. We're told that 9 out of 10 people who need treatment aren't getting it. Again, that's one reason CARA is so important. It will get more people into treatment. Mr. President, as I said before, I take the House leadership at their word when they say they'd like to move this legislation and move it to regular order. I understand that, but I will say this. They need to move, and they need to move quickly because of the urgency of this issue, because of the fact in their communities and the communities represented here on the Senate floor, which is every community in America, because every single state here had a United States Senator support this legislation. People are waiting. They need the help. We can provide the help. We can make the federal government a better partner. We can deal with this crisis. I'm going to do everything in my power to protect the people of Ohio, even if that means continuing to come out here on the floor every week and continuing to do everything I can, including making calls, as I did yesterday, over to the House of Representatives, including talking to my colleagues personally, including telling some of these stories I've told today. People's lives are at stake. We have to move this legislation. We need to get it to the President's desk. He will sign it, and it can then begin to make a real difference for the families we represent who are so affected by this epidemic. Thank you, Mr. President. I yield back my time.